As a pediatrician and a mom, I know that one of the biggest worries for new parents is their baby's health. Your little one's skin is so soft and new, and their tiny mouth is exploring the world for the first time. This makes their skin and mouths incredibly sensitive and, at times, prone to little issues. It's completely normal to feel a jolt of concern when you spot a new rash, a mysterious bump, or a white patch inside their cheek. Understanding these common occurrences is the first step toward feeling more confident and in control. Think of your baby's skin as their first line of defense against the outside world. It's a protective barrier, but it's still developing and learning to adapt. Similarly, their mouth is a gateway for nutrition and comfort, but it's also a warm, moist environment where things can sometimes grow. Most of the time, the little spots and sores you might see are harmless and will resolve on their own with a little tender, loving care. My goal here is to give you the tools and knowledge to tell the difference between a minor hiccup and something that needs a doctor's attention. It's important to remember that almost every baby will experience some kind of rash or mouth issue in their first year. Newborn acne that mimics a teenager's breakout. Diaper rash. They are signs that your baby's immune system is learning and their body is adjusting to life outside the womb. This guide is designed to be your trusted resource, a 9-minute MD tip sheet you can turn to for clear, practical advice. Let's start by learning to read the signs your baby's body is giving you. Remember, you've got this, and I'm here to help you navigate this journey. The first step in understanding what's happening with your baby is to become a keen observer. Your baby can't tell you what's wrong, but their skin and mouth can offer important clues. The most common signs parents report are rashes, sores, blisters. A rash can appear in many forms. It might be flat or raised red or skin-colored patchy or widespread. It could be made up of tiny pinpricks or large, splotchy areas. Pay attention to where the rash is located. Is it only in the diaper area? Is it all over the torso? Or is it concentrated on the face and scalp? Another key symptom to watch for is your baby's behavior. A skin or mouth issue is often accompanied by changes in their mood or habits. A fever is also a critical sign. Taking a quick photo with your phone each day can be a great way to track these changes accurately. Now that we know what to look for, let's connect these symptoms to a few common baby conditions. One of the most frequent rashes is diaper rash, which appears as red, irritated skin in the diaper area. Typically a contact rash from prolonged moisture exposure. Sometimes a yeast infection develops on top of it. Bright red patches with smaller satellite spots around the edges. Another common sight is baby acne. Small red or white bumps on the face, neck, chest. Usually caused by maternal hormones and almost always harmless. Moving beyond the face and diaper area, you might encounter eczema or atopic dermatitis. Dry, red, itchy patches, sometimes weeping or crusting. Commonly on the cheeks, scalp, crooks of the elbows and knees, often linked to a family history of allergies or asthma. If you see a lacy red rash on the torso after a few days of high fever, it could be roseola. Key pattern: fever first, then rash as the fever breaks. Heat rash, or prickly heat, appears in warmer weather. When you see sores or blisters, especially in or around the mouth, a few specific conditions often come to mind. One of the most common is oral thrush. It appears as creamy white patches on the tongue, inner cheeks, gums, roof of the mouth. These patches look like cottage cheese and cannot be wiped away like milk residue. If you try to scrape them, they might bleed. Thrush can make a baby fussy and unwilling to feed because their mouth is sore. It's important to treat, as it can be passed back and forth between a baby's mouth and a breastfeeding mother's nipple. Another very common culprit is hand, foot, and mouth disease. This is a viral illness caused most often by the Coxsackie virus. It typically starts with a fever and general malaise followed by painful sores in the mouth. These sores often begin as small red spots that then blister and can become ulcers. A day or two later, a non-itchy rash or blisters may appear. The mouth sores are usually the most bothersome part for babies, making eating and drinking painful. Knowing when you can manage a situation at home and when to call the doctor is crucial. For many common skin issues, simple home care is often sufficient. For a standard diaper rash, keep the area clean and dry. Change diapers frequently. Use a gentle wipe. Use just water. Allow for some diaper-free time to let the skin air out. Applying a thick layer of a zinc oxide barrier cream can protect the skin from moisture. For baby acne, keep the skin clean and dry. For heat rash, avoid overheating. Dress your baby in light, breathable layers. For mild eczema, home care focuses on moisturizing. Bathe your baby in lukewarm water for no more than 10 minutes. Use a gentle, fragrance-free cleanser, then pat the skin dry. Immediately apply a thick, fragrance-free emollient or cream to lock in moisture. You should schedule a visit with your pediatrician if home care isn't working, or if you're unsure of the diagnosis. If a diaper rash doesn't improve after a few days, or looks bright red with satellite spots, it could be a yeast infection requiring an antifungal cream. Any rash that is accompanied by a fever should prompt a call to the doctor. When you bring your baby to my office with a skin or mouth concern, my diagnostic process begins the moment I see you. The most powerful tool I have is a thorough physical examination and a detailed history from you. I will ask you many of the questions we've already discussed. When did it start? Where did it first appear? Has it spread? What does it look like? Is your baby scratching? Do they have a fever? How is their feeding and sleeping? Your answers provide the context I need to start forming a diagnosis. I will carefully examine the rash or sores, noting their location, pattern, and characteristics. For most common rashes like eczema, diaper rash, or baby acne, the diagnosis is clinical, based on classic appearance and history alone. I might use a light to get a better look at skin texture. For mouth issues, I'll use a tongue depressor and a light to inspect the inside of your baby's mouth. Most of the time, a good history and a careful look are all that's needed to get your baby on the path to recovery. While you can't prevent every illness, you can establish simple routines that significantly reduce the risk of common skin and mouth issues. For skin health, the foundation is a gentle hygiene routine. Avoid harsh soaps, avoid bubble baths, avoid products with fragrances or dyes. These can strip the skin of its natural oils and cause irritation. Opt for lukewarm, short baths. Use a mild, pH-neutral cleanser designed for babies. After the bath, pat your baby's skin dry gently. Don't rub. Apply a generous amount of a fragrance-free moisturizer to their entire body to maintain a strong skin barrier. To prevent diaper rash, the mantra is clean and dry. Change your baby's diaper as soon as you know it's wet or soiled. This minimizes the skin's contact with irritating ammonia from urine and enzymes from stool. During changes, clean the area thoroughly with gentle, alcohol-free wipes or just a soft cloth with warm water. Allow the skin to air dry completely before putting on a fresh diaper. Using a barrier cream with zinc oxide at every change provides a protective layer. Navigating the world of baby rashes and mouth sores can feel overwhelming, especially when every new spot can seem like a major cause for alarm. I hope this guide has helped demystify some of these common conditions and provided you with a clear framework for when to worry and when to relax. The most important takeaway is that the vast majority of these issues are minor, temporary, and a normal part of your baby's first year of life. Baby acne will clear, cradle cap will flake away, most viral rashes will run their course without any lasting effects. Your calm and steady presence is the best medicine for your baby. You can feel reassured when your baby has a rash but is otherwise happy, playful, and feeding well. If the rash is confined to one area and it responds to simple home care, you are on the right track. You are the expert on your child, and your observations are your most valuable tool. Ultimately, the most important piece of advice I can give you is to trust your parental instincts. You know your baby better than anyone. There is no such thing as a silly question when it comes to your child's health. You are doing a fantastic job, and with a little knowledge and a lot of love, you can handle whatever comes your way.